A very good evening to all of you. Myself, Dr. Salman, and guys, we are going to start with the discussion of the NEET-PG questions. Just a disclaimer before we begin. I'm sure everybody knows this. The questions that we are going to have here definitely will have a change of language. The whole idea is to get the main topics that were tested in the exam with, relatively closer language that was asked. Please feel free to, correct us, put your comments down below, and you can tell us in case the options were different or the language of questions. Even one word, if you can add in a question, that is more than welcome. Okay, we will be always grateful to you. Before I begin, I would like to say, like, this time, this batch who's taking this exam is no less than any warriors. With all the things that went on with the NEET-PG saga this time, let it be the centers, or in fact, even on the day of exam, we got to know like some students have missed the exam due to the things that happened, that is the monsoon season, traffic congestions, etc. Despite that, having all the mental tension, you guys took this exam. We really hope that you guys, get out of this in flying colors, and I'm sure you did your best. So let's not think about it. Whatever happened, happened. You guys are going to do well. As of now, let's just, let the time sink in. And after this, eventually, all the questions, etc., that has come, slowly people will start telling us this was like that, that was like that. First day when we are tired, a lot of things may not be so accurate what we get. So let us begin with the first question discussion here. So a man presented to a physician with abdominal pain since last few days with a history of fever and bradycardia. Now the history reveals he eats frequently outside due to regular traveling. Which test is used to confirm the diagnosis? See, one thing is clear here, that if you're eating outside, something with fecal-oral might come. From the given options, you can actually figure out they might be talking about typhoid. Now, what tells me that this is typhoid? See, one thing, fever is there, and you know that bradycardia, that is relative bradycardia called as Fagot's sign, is seen with typhoid. So this tells me most likely this is typhoid. One more feature they may or they may not have mentioned in the question, and that could have been the rose spots. Obviously, they will not write the exact word rose spots. Some things related to some rashes on the thorax, etc., may be mentioned. So whatever it is, this gives us a clear picture that they're talking about something known as typhoid. So since the diagnosis is typhoid here, now we need to know some things. According to the exposure, since the time the patient has been exposed to this disease, there are different tests that we prefer. For instance, in the first week, we would prefer blood culture. Second week, we would prefer Vidal test. Third week, stool culture. And fourth week, urine culture. So why is it like that? A lot of us know this famous test called Vidal test. What exactly are we doing in Vidal test? In the Vidal test, we detect antibodies against the antigens of Salmonella typhi. Okay, we are detecting antibodies. And you must always remember, antibodies are formed at least after 1 week. So obviously, if you're doing Vidal test in the first week, it will come negative, right? So that's why we should not do it in the first week. Vidal test is only done after 1 week. Now in the question, since they have mentioned a history which is less than a week, the best answer from the given options has to be blood culture. Okay, so I hope you guys got it. Now there is this very famous mnemonic, I'm sure you guys know, something called as BASU. So what is this BASU? First one is blood culture. Second is antibody detection test, which happens to be an example of agglutination test. So we can remember agglutination test, that is the A. Next, S for stool culture, U for urine culture. All right. Next question. A patient presented with fever, nuchal rigidity and rash. He informs that he has a military background. Microscopy reveals a gram-negative organism. What can be the most likely cause? Okay. Now, if you see one thing here, nuchal rigidity tells us that this must be a case of meningitis. Now, as far as I know, this is meningitis. If I look into the options, I can see at least three options. First three options that are like routine organisms causing meningitis. Okay. So first three options can be correct. Now I guess they have given gram-negative organism in the list. Gram-negative means Neisseria is also gram-negative, Haemophilus is gram-negative, Klebsiella is also gram-negative. So that is not helping unless and until they might have given gram-negative cocci. Cocci means the answer is loud and clear Neisseria. But they didn't give that as far as I know. So anyway, gram-negative is not helping me, although all the three organisms are like that. Is there any other hint that guides me towards the answer? Yes. The most unique feature, that is the rash. I'm sure you all know that rash is a very particular feature of Neisseria meningitidis. It's not seen in other organisms who causes meningitis. So because of the presence of rash, this guides me towards the answer called Neisseria meningitidis. And one more history they gave, usually military barracks or some religious gatherings where people are in close vicinity of each other. So that time, once again, there can be always outbreaks of this Neisseria. Now, do remember one more correlate that may come in the coming exams. MAC deficiencies predispose us to Neisseria infection. Membrane attack complex, which is a part of our complement system, right? So if that is deficient, it can actually lead to Neisserial infections. Fine. So this is all it is. This is Neisseria meningitidis as per the given question. Next is a female patient presents with burning micturition. Urine sample was collected and the testing showed the organism is coagulase negative and novobiocin resistant. What is the most likely agent implicated in this? All right. Now, first thing is clear that burning micturition means most likely it's a UTI, and for that reason only the urine sample was collected. Yes. Now the organism is showing something called coagulase negativity and novobiocin resistance. So based on this, although the agents here, most of them can cause UTI, example Proteus can do that, E. coli is the most common cause of UTI, and Staph saprophyticus, all these things are here. Although E. coli is the most common organism causing UTI, I would not choose this answer here. The reason is they are actually describing this classical case of honeymoon cystitis. Honeymoon cystitis, usually younger females, who are recently sexual active, they may get this. So check this out. Female was given and then coagulase negative and novobiocin. So first of all, what is this coagulase test we do and for what purpose? Coagulase test is done to identify the species of Staphylococcus. If the test is positive, you should know it is Staph aureus. If the test is negative, then you must know these organisms are called as cons. The word cons stands for coagulase negative staph. Okay. Now, once you know it is cons, now our duty is to identify the two species. What are the two species in the cons? One is saprophyticus, another is epidermidis. Both of them are coagulase negative. Since both of them show the same result, how should I know whether it is epidermidis or saprophyticus? We do one antibiotic test. What is this antibiotic? Novobiocin. So novobiocin resistant, it is saprophyticus, and novobiocin sensitive is epidermidis. So our correct answer here will be saprophyticus since the word resistant was given. The way you can remember, the one is sensitive. Skin is sensitive. Skin is sensitive. Look at the word epiderm. Epiderm is sounding like skin. We'll remember skin is sensitive. So that's all it is. Saprophyticus is the answer. So next question in this list here. A patient was put on a central line a week ago and she developed fever following that. Microscopy reveals gram-positive organism that multiplies by budding. Which of the following best matches with the clinical situation described here? Now guys, some of the people actually made a mistake in this. They looked at the word central line, which I 100% agree. Central line, catheters, cannulas, this kind of words when they mention, you have to think about staph epidermidis. But here, gram-positive, one more word was given. So they quickly jumped to the conclusion, staph epidermidis. I'm sure if you look at this question now, you will be able to answer this correctly. But that's the thing, in the exam, there is so much pressure. Silly mistakes may happen. So, sir, this question, the answer is not epidermidis. Rather, the answer is candida. You know why we are choosing the candida? First of all, you must know, even fungi we can do gram stain. Next, budding was mentioned. Budding was mentioned. See, fungi are broadly of two types. One type of fungi, they are called as yeast. Another type of fungi are called as molds. Okay, molds produce something called as hyphae. That's their unique feature. They produce hyphae, and yeasts produce something called budding. They reproduce by a process called as budding. Okay, now this candida is a yeast, although it's described in yeast-like category, and there is a very special feature called pseudo-hyphae with this guy. The point is this, it is actually a yeast. So budding word was mentioned. So that's why we are going to go with this answer called as Candida albicans. If budding was not there, then you would be 100% correct if you chose epidermidis. Next question, this is more or less easy. A patient presented with complaints of perianal itching. This history itself is enough to tell us the organism. It's a very unique thing, right? Perianal itching specifically. This is by someone called as Enterobius vermicularis. Apart from this, I believe even the egg picture was given. I'm not sure if the word perianal itching was described or not. Okay, please let me know in the comments. So either way, if image was given or perianal was given, then you have to choose the answer as Enterobius vermicularis. Now, what do you need to see? Like in this egg, I'm not talking about textbook words. If you see, first of all, this eggs, they have this line in between them and they kind of look like coffee beans if you see. All right, so you need to remember coffee beans here. Now, the way I teach students so that you can kind of imagine and remember, you need to draw this kind of a border that I just did here, right? This kind of a border, if you draw and remember, we remember it as E for Enterobius. Okay, this would be E for Enterobius. This is how this egg needs to be memorized. There are other eggs also that we have in parasito, and there are ways to remember them. So this is a easy way that usually some pictographic mnemonics that can stay in your head. So Enterobius should be the correct answer for this. Next, let's move on. A farmer presented to the hospital with fever, retroorbital pain, red eyes, conjunctival suffusion, calf tenderness, and joint pain. What is the probable diagnosis that you can expect in here, friends? See, you must understand something. If they had mentioned these things, example, red eyes, that is conjunctivitis, this words, along with calf tenderness, you must know most likely they're talking about one infection called leptospira. Okay, the correct answer here is going to be leptospira. So, sir, couple of things that I will tell you. Leptospira, a similar type of a question has already been asked in the NEET-PG previously. So topics would be more or less repeated. like, something that has been asked before, similar type of a things will come. Definitely, I understand under exam pressure, and definitely there must be changes in the language, etc. But the theme remains, something similar. So leptospira is the answer. Now maybe next time they can switch over and ask you something else. So I'll just tell you like what is another thing that you must keep in mind that can be asked in the future of this. See, there is a test that we actually do for the diagnosis of that guy that is called as microscopic agglutination test. Okay, so I repeat, this is called as microscopic agglutination test. Okay, now let us check this out. What exactly is microscopic agglutination test? Sir, there are three agglutination tests that I would ask you to know. One is cold agglutination test. Okay, cold agglutination test. This is one. Next, standard agglutination test. Standard agglutination test. And third one that I would say is microscopic agglutination test. Microscopic agglutination test. Okay. So these are the three names that you are going to see here. Now all these three tests, anything can be asked in your upcoming exams. Let's remember for which organisms we do this. This is done for mycoplasma. Mycoplasma. This is done for somebody called as Brucella, and this is done for leptospira that we just said. Okay, so you got to remember this by one mnemonic. You can remember cat sat on mat. Cat sat on mat. Maybe later. Maybe later. Okay, so memorize it like this. Cat sat on mat. Maybe later. So this is once again another anticipated MCQ. Leptospirosis is a disease which has one more name called Weil's disease. Hepatorenal syndrome. They can be jaundice, they can be renal failure apart from all these features that you're seeing here. So it's again a routine MCQ. This organism happens to be one of the spirochete. Okay, and moving on to the next question. A patient presented with painful genital lesions that is tender to touch as shown in the image below. Identify the disease implicated in this. Now guys, one thing right away. See, you all must be knowing that definitive there will be questions on STDs, and this exam was no different. They have asked questions on this. Whenever you're reading a question of STD, always remember you should keep in mind either the STDs may present as lesions on the genitalia or they will present as discharge. This place lesions were said and they were shown. So I know these are lesions. All right, I can see them on the genitalia. But there is one more buzzword right away they gave, that is painful. The moment the word painful comes, you should know right away either the answer is going to be chancroid from Haemophilus ducreyi or the answer is going to be herpes, one of the two. Unfortunately, in the options, you see both of them, herpes is also there, chancroid is also there. But there is one more thing, they gave the image, right? Image is showing this all small vesicular lesions. Sir, if you see recurrent, painful vesicular lesions, this is the identity of herpes. Herpes produces all vesicular lesions. If you check shingles, if you check, all these things, you're going to see these vesicular lesions. So that's it. The best answer for this dude would be HSV2. HSV2. I don't know if number 2 was mentioned or not. Either way, HSV1 and 2 both causes STD. It's more common by number 2 compared to number 1. All right. So that's all. Next. Moving further, a traveler presented with diarrhea, abdominal pain and vomiting after consuming seafood. The organism also showed positivity for something called as Kanagawa phenomenon. Which of the following is the likely cause? Okay, which of the following is the likely cause? So, guys, remember, basically whenever they talk about food poisonings, there might be some buzzwords. Chinese fast food. If they mention Chinese fast food, Answer would be most likely Bacillus cereus, right? Like that, some kind of food they will mention for us to choose the answer. This time, seafood was given. You should know whenever they mention seafood, there are some vibrios that are associated with this. Okay, there are some vibrios. These vibrios are called as halophilic vibrios. Look at the word itself, the halophilic word. Okay, the halophilic word. Halo means salt, salt loving vibrio. Where is salt abundantly found? In the sea water. That's why these guys are found in the seafood. Okay, and you must be knowing in a lot of countries, seafood is consumed pretty much raw, pretty much raw. Example, sushi and many other things. And one more hint that they're given me to choose this correct answer is Kanagawa phenomenon, which also happens to be, once again, a previous MCQ in this exams. Kanagawa phenomenon. It's nothing but a agar in which we add salt. Basically, it's a salt containing agar. Then only this organism will grow because it loves salt. That is what is called Kanagawa phenomenon. Okay, there is one agar called as Vagatsuma agar. Okay, Vagatsuma agar. On this, we can demonstrate this Kanagawa phenomenon. So, because of this, the correct answer is going to be Vibrio parahemolyticus. They are the halophilic vibrios, not the routine Vibrio cholera. Okay, there is other guys also in this list. So, from this options, this is the organism that should be correct. Now, this is easy peasy. Desert rheumatism is associated with which of the following organisms? Desert rheumatism is the name that is given to an infection that is caused by coccidiomycosis. Coccidiomycosis. Sir, I'm sure you know histoplasma. Most of these organisms that you're seeing here, they are all dimorphic fungi, and dimorphic fungi are more common in American continent. They are endemic in America. So that's why if you see histoplasma has a name like Ohio fever. Okay. There is a name called as Chicago disease. So all these names, if you see, these are all states in America, yes or no? So like that, desert rheumatism, this is seen especially in those areas, where the deserts are. You need to keep in mind when you're talking about the desert se camel yaad rakhna hota hai, and C for camel, C for coccidiomycosis. Coccidiomycosis. So this guy, apart from the routine features of dimorphic fungi, what does dimorphic fungi do? They all cause pulmonary infection. Apart from the pulmonary infection, desert rheumatism causes some nodules, erythema nodosum, and it also causes arthritis. Because this swellings under the skin and arthritis is present, it is compared to rheumatism, right? Rheumatism. I hope you guys understand that. So this is the answer. Next question is, a child shows chorioretinitis, hydrocephalus and parenchymal calcifications. What is the most likely diagnosis? What is the most likely diagnosis? All right. So guys, the moment you see this kind of a question, the first thing that should pop in your head is torch. Okay. The torch, where we all know T for toxoplasma, O for others, R for rubella, C for CMV, H for herpes. So these are all the organisms that exist in this list. So sir, from this list, there are a couple of features that tells me most likely this is the answer. All right. Now, one thing is, if you see calcification, right away it should ring bells. There are two answers that are possible. One is toxo, another is CMV. One of the two things. Next, once this is there, I need to know one more word. If the word is periventricular calcifications, then I would have chosen CMV. But if they mention parenchymal or cerebral calcifications, then I would choose obviously the answer as toxoplasma. Okay, so this is what you must know. Toxoplasma will become the answer. A patient having history of HIV developed diarrhea. Stool microscopy for the eggs was negative. That means eggs were not found. There is presence of some larvae inside this. Identify the organism that was mentioned. Okay. So who do you think the answer in this is? See, normally speaking, whenever we get to hear the word, HIV and diarrhea, some organisms that should pop into your head is Cryptosporidium, Cyclospora, Isospora. Okay, that guy is now called as Cystoisospora. But anyway, these are the guys usually we know, and I'm sure you may remember these are those guys that have eggs that are acid fast. Pink color eggs would be seen, but eggs were negative in this. One thing is clear, that means it cannot be this Cryptosporidium, etc. Now comes the point. Remaining three. Schistosoma mansoni. This is a guy that is associated, with certain things like Katayama, fever, etc. Okay. Next, Ancylostoma duodenale. Ancylostoma and Necator are those worms that are usually associated with iron deficiency anemia. Strongyloides on the other hand, you must remember that this causes hyperinfection in HIV patients. Since HIV history is mentioned and one of the worms from the three has to be chosen from this, the best answer will become strongyloides. And one more thing that you must always keep in mind is there are no male worms in strongyloides. There are no male worms. There are only females. In fact, you can remember strong ladies. Okay? Strong ladies. Are you understanding this? Feminism at its peak in the worms. So, strong ladies. No male worms in this. Please remember this process or this special thing is called parthenogenesis. Okay? We call it as parthenogenesis. A very unique feature that exists in this worms, that only they are ladies but still they are able to reproduce. Okay, so that's why this answer that I'm going to choose for this is going to be strongyloides, my friends. Okay, next one. A farmer suffered a wound in his foot. Now there is a swelling with sinuses discharging pus. Microscopy of the discharge shows gram-positive filamentous organisms. Identify the organism. All right. Now, one thing you must understand is, since they are mentioning the history of something in the feet, mostly a topic that is tested in exam all the time related to feet is mycetoma, also called Madura foot. So this mycetoma or Madura foot can be caused by two things, as we know. One is bacteria called actinomyces. Hence, it's called actinomycotic mycetoma. Although the name says actinomycotic, it's not just actinomyces, even nocardia. There is one more guy who's involved, that is nocardia. And then there is fungal ones, which is called as eumycotic mycetoma. Fungal species like Madurella, etc., they are going to do this. So since they mentioned this word gram-positive, first of all, and second they mentioned filamentous organisms, filamentous. See, this is a very unique feature of these organisms. Normally a rod is rod like this, but these guys are all going to appear like this, all haphazard like branches. So this is the branching filamentous appearance, a very unique feature of this. And one more thing that I would like all of you to know is, nocardia is even going to have acid fast staining. It is also acid fast, although it's called partially acid fast, but it is acid fast. Okay, so they can do that as well. They can give acid fast staining and they can do that. So here we go. We are going to choose the answer as nocardia over here, friends. Nocardia. Okay. Next, let's keep moving further. A patient presented with a diarrhea and was later diagnosed with EHEC. EHEC stands for enterohemorrhagic E. coli. Enterohemorrhagic E. coli. The strain is O157H7. What does the H antigen indicate here? H antigen indicate here. That means in this naming like O157 and H, what is this O and H? O is the somatic antigen that exists in this. Okay. H is the antigen that represents flagella. H is the antigen that represents flagella. See, this organism is from this family, what we call as Enterobacteriaceae family. There are many members in this. Some of them are motile, some of them are non-motile. The guys who are motile will always have H antigen, right? They will always have the H antigen. So we are simply going to remember the answer to this will be flagella. Motile organisms, flagella. This is the word. Next, doctors, let's check this out. An adult man presented with discharge from the urethra with history of unprotected sexual intercourse. Gram stain of the sample is shown below. What is the drug of choice for the treatment of this patient? Okay, now let's try to understand something. Sir, when we are saying sexual word, once again, we are talking STD right here. Gram stain is given. Now, if you pay a slight attention to the gram stain, you can see the organisms are here. Okay. See, this is not organism. These are our WBCs. Those little things, these are the organisms that you're able to see. So obviously a very clear picture must have been given in your exam. Pink color round organisms are seen. Pink means gram negative, round means cocci. So simply put, now I know this is a gram negative cocci. Gram negative cocci. So sir, once I know this is gram negative cocci, I already know the answer. This is Neisseria gonorrhoeae. Neisseria gonorrhoeae. Sir, for Neisseria gonorrhoeae, one of the best medicine is ceftriaxone, right? It is a injectable ceftriaxone. But the question did not give ceftriaxone. There is a cousin of ceftriaxone which is available in oral form, na? That is cefixime. See, it's a general practice. You all must be knowing ceftriaxone, the word you hear, you should know injectable. And then cefixime is usually the alternate form which is given in the oral. Same thing we do in typhoid also. Typhoid also, we can give ceftriaxone if the patient is admitted, or we can give oral cefixime. So sir, bas itna hi basic you had to know, and that's all. Acyclovir would be given for the viral infection called herpes. You can see benzathine penicillin is given for syphilis. So like that you could have easily ruled out. So the answer here has to be cefixime. Next, my friends, let's move. An adult man, same story, I believe something of this sort was asked. An adult man presented with discharge from urethra with history of unprotected sexual intercourse. Gram stain of the sample shows gram negative cocci. So they said gram negative cocci. So I know this is Neisseria. I know this is Neisseria gonorrhoeae. What is the culture media used for this patient? That's the question that they've asked. What is the culture media for this patient? Sir, you all should know one thing. Culture media that is used for the Neisseria, it is called by the name of Thayer-Martin media. Okay, this is known as Thayer-Martin media. LJ media is used for TB. PTA, potassium tellurite agar, is used for diphtheria. MSA, that is mannitol salt agar, is for staph aureus. So sometimes, this is a pure memorization. This is something that you have to look at like 1 to 2 days before exam. Culture medias. Next question is, a young boy uses contact lenses on regular basis. He was careless about his lens fluid, etc., and therefore developed keratitis. Microscopy showed an organism with spikes, etc. Identify the organism. Okay. Now, from the given list, I believe it's not so difficult to figure out something. First of all, if they're asking about keratitis or lens, etc., the most common organism is Pseudomonas. Okay. Pseudomonas, this happens to be the most common organism. Let's say they wanted to ask you fungus, then they could have given Aspergillus. Okay, Aspergillus also can do that. But Pseudomonas is the most common organism overall. Now in this question, they have not given that as the option. The next thing is there is a parasite, right? There is a parasite. So this happens to be in the amoeba category. Na? So ant amoeba is one amoeba that causes dysentery, bloody diarrhea. But that's not what they're asking here. There's one more called acanthamoeba. Acanthamoeba is the one that is associated with this lens infections. Naegleria has something else. Naegleria does something called as PAM. primary amoebic meningoencephalitis that is associated with swimming. Okay, so it's a straightforward question, acanthamoeba keratitis. That's how you should in fact memorize this, and you may all know this is how I teach in my class. 2 words only, acanthamoeba keratitis. Sir, let's move on. The next thing is a patient developed aplastic crisis following a viral infection. Identify the organism. Okay, see, first of all, this word itself should ring a bell. Like that one word is enough if this was really given in the question. That is the buzzword for this organism. Aplastic crisis is seen by parvovirus B19. Parvovirus B19. Okay, so what is the story? You can remember that parvovirus has special predilection towards your erythrocytes. We can remember B for blood cell called RBC. We can remember like that, right? B for blood cell, that is RBC. So let's just assume as simple that it may reduce your RBCs. Let's just say that. And if you're already having one existing anemia, if you're already having some existing hemoglobinopathies, this will be definitely causing that crisis. Already the anemia is worsening you, plus this virus will now add on to the problem. That is called as aplastic crisis. Usually it does it in sickle cell anemia patients. Okay, sickle cell anemia patients. So you must keep this in mind, my friends. Okay, sickle cell anemia patients. Done. So this answer would be parvovirus B19. Next one, if we continue further, a patient presented with edema in the lower limbs. Microscopy showed sheathed organism with absence of nuclei in the tail tip. What is the most likely organism? Okay, see, I have always emphasized during my classes that if a question comes on this topic, mostly it's going to be this. Although it looks like such a, daunted, precise information that we need to know in the tail, nuclei are present, not present and all that. But we need to know this for the answers. Let us look at something, then we go back and solve that MCQ. This is a table that I want you to fit in your head before you go into the exam hall. Most of the time, if a question comes on this, this is it. Okay. So, sir, here is a chart that is showing you all the filarial agents. Okay. Filarial agents. First two are, the agents which we classically know for the elephantiasis or the filariasis, classical filariasis. The other two, they are going to cause subcutaneous filariasis. Okay, organisms like Loa, Onchocerca, etc. So these organisms are also associated with filariasis, by the way. Okay, now let us begin. What are the things that you need to know? So first thing, Wuchereria bancrofti. When you talk about somebody called as Wuchereria bancrofti and Brugia malai, as I said, they are associated with lymphatic filariasis. These two are associated with lymphatic filariasis. Bancrofti, you need to remember, it is bankrupt in nuclei. Bancrofti is bankrupt in nuclei. This is the word that you must keep in mind. Okay. Next, Brugia malai. This is the guy. Brugia malai. This is the guy that has 2 to 3 nuclei. 2 to 3 nuclei. All right. So first thing over. Sheath is present in everybody except one guy called Onchocerca. Now I'll give you a hint how to remember this also. Onchocerca is associated with something called as river blindness. It is associated with river blindness. Imagine the person is blind. Imagine we are blind. Neither the sheath can be seen nor the nuclei can be seen. Kuch dikhega hi nahi. Sab absent. Everything is absent. So as I said, in this condition Onchocerca, everything is absent. There is nothing else. Ab what are we left with, sir? We are left with the remaining three. Bancrofti, Brugia malai and Loa. Okay, Loa. So now that you know this, sheath is present in all that was mentioned. Sheath to tha. But what decides whether it's Bancrofti, malai or Loa? Here we go. absent. Bancrofti, it is completely absent. In the Brugia malai, M for malai, 3 nuclei are present, and in loa, multiple are present. Okay, in loa, multiple are present. So now let's go back, read this question once again. Maybe some hint now we can get from this. A patient presented with edema in the lower limbs. There is no nuclei in the tail tip. Since they mentioned there is no nuclei in the tail tip, then we should go for the answer. Oh, the options printed here are wrong. Okay. Anyway, the thing that you should go for, it is Wuchereria bancrofti. Okay, so I'm not sure what all options were given, but the answer has to be Wuchereria bancrofti. Okay, don't worry, I'll ask the team to get this corrected. There might have been a misprint while they were making this. Next, now that we are done, let's take this further. A woman who is in her reproductive age presented with foul smelling discharge, pelvic pain and dysuria. Clue cells were also noted. Which of the following is responsible organism for the same? Now, this is one question which I would say is definitely controversial. One reason is clue cells, if they gave, see, trichomonas, when you get, there is a very good chance that you may also get bacterial vaginosis also. So that may be reason, clue cells are seen. And some studies have shown, clue cells being present in trichomonas also. In fact, that fishy odor they talk about even in trichomonas, by the way. Although that fishy odor of whiff test we know from, Gardnerella, that is bacterial vaginosis, they say that sometime, but that's a very controversial point. Okay. So since I am not left with any other option in this, because CMV is not going to do this, HPV is lesions, it's not discharge. Now, discharge word is already given. So this is not possible. Herpes is again lesions. Because of that, then I'm going to go for this thing, that is trichomonas. So please correct me, guys, in case clue cells etc. were not mentioned, then it's more of a straightforward question only. All right, that's it. Now, next one, causative organism for the image shown. Okay, causative organism for the image shown. So once again, I would say this is also slightly controversial question that was asked. But let's just have a look at this, what we can actually answer from this. It is given ectothrix or endothrix. One picture was given. What is this ecto and the endothrix? This basically is the hair shaft, hair follicles, hair shaft. Now the thing is, there can be infections of this. If the fungal infection is happening on the hair shaft, this is outside, so it's called ectothrix. You can see this is basically the hair. This is the hair you can see here, and then around this, these are all the things that you're able to see. They are called ectothrix. Then there is endothrix. Endo word means inside, so you can see once again this is the hair follicle and then hair shaft. You can see things inside. Now, sir, simple word one I get to know when I look at this question is hair involvement they have given. Hair involvement. Candida, I will rule out from this. Epidermophyton also, I will rule out from this. Why would I rule out epidermophyton? Skin and nails are involved by epidermophyton. They mentioned hair. So this cannot be the option. Now, trichosporum, trichosporon or microsporum, one of the things can be there. Because microsporum also involves skin and hair. Trichosporon, bijli, if you know, trichosporon, bijli, this is how we learn, na? Bijli is white. It is associated with white piedra. Piedra is also infection of the hair. So I don't know if there is more history or something that was given. Please help me with that. Otherwise, even I cannot choose the correct answer from this. It could be this also. It could be this also. Okay. I hope you guys are understanding this. Piedra is an infection of the hair only, na? We have black piedra and the white piedra. So now that we are seeing this here, let's move on. Next, A female presented with a symptomatic UTI and growth of staph saprophyticus with 10 to the power of 4 colonies of novobiosine resistance were noticed. Choose the correct option for this. Okay, so first thing you must understand is, normally speaking, there is something called CASIS criteria for the diagnosis of UTI. Okay, in this there are different things that are present. I'm not going to teach you the entire thing right now. I'll just tell you, usually if you see 10 to the power of 5, greater than 10 to the power of 5 organisms, that means 1, 2, 3, 4, 5. More than these many bacteria, if you're seeing in the urine sample, then you are going to say this is a UTI. But here 10 to the power of 4 only was given. Now there is one more clause in this. If it is symptomatic, even 10 to the power of 4 is considered as a UTI. Are you understanding that? Generally, if asymptomatic person has greater than 10 to the power of 5, we call it a UTI. But now since the person is symptomatic, this has to be considered as a UTI. That's it. Okay. So I hope everybody understood this. Next, sir. Another question. This is from immunology. What is the function of interleukin 8? Interleukin 8. Sir, the fever is associated with interleukin 1. Activation of Th1 response, it is by interleukin 12. Chemoattractant for neutrophil is this guy called interleukin 8. Interleukin 8. Okay. Proliferation of CD8 cells once again become interleukin 2 over here. Interleukin 2. So now that you're looking at these things, what is the function of interleukin? It is given here. It's a chemoattractant, right? So technically there are some other chemoattractants also, like leukotriene B4, interleukin 8, C5a. These are all the other guys that are also chemoattractants. So keep an eye on this. Like once they ask one thing like this, they may ask something else in the next exam. Okay, so I'm repeating. You have C5a. Okay. Next you have leukotriene B4 and this interleukin 8. This Nugent score or Amsel's criteria, if you know, this is straightforward, that is used for the diagnosis of bacterial vaginosis. Now in the recent exams, like last year in the FMGE examination, they've asked Amsel's criteria is used for the diagnosis of, and I believe this time they just changed it a bit and they asked Nugent score is used for bacterial vaginosis. And this is a very frequently tested topic. Bacterial vaginosis, either that or it's antibiotic, everything, you must know back forth. Next, this also apparently was given. Please do comment and let me know. Did you actually get this? Broad-based budding image was given. See, for instance, what exactly is budding? This is a yeast cell. It's a unicellular cell. It reproduces by a thing called budding. Let's say if I'm talking dimorphic fungi, if I was given this image, then I would say this is histoplasma. Okay, I would say this is histoplasma. It shows narrow-based budding, nothing special. But if you see this kind of a appearance, like a number 8, etc., number 8, this is called broad-based budding. And this is a feature of blastomyces. And guys, the way you should remember this is, it looks like letter B. Imagine it like letter B and write down. This is going to be blastomyces. Okay, blastomyces. So that's all about this. Next, one more image-based question I believe that was given. A child suffering from diarrhea and vomiting. EM, that is electron microscopic picture of the organism, is shown below. Identify the organism. Identify the organism. Now, if you look at this image, what they're showing you is the wheel-shaped organism. Wheel-shaped organism. And you must know this wheel-shaped like organism, what you're looking at. This is rotavirus. Rotavirus. Rotavirus is obviously the most common cause of diarrhea in children, as we all know, nothing new. So that was asked, but I don't know the other options. So this is what you will answer. And you will remember that this is rotavirus because of its wheel shape. And we will remember wheel rotates, wheel rotates. You know, you may see children, okay, playing with this. This is something that is very famous in India. We all know this, right? Children play with tires. They are going to play with this wheels, technically. So I'm just saying children are associated with this. You should know this word, wheel shape rotavirus. That's the word right there. Okay. So this is all. We are done with this section. Please follow me on Instagram. This is my handle, Dr. SALK. That is same thing as you see in the vaccine called Salk. Okay, polio vaccine. So Dr. underscore SALK. This is my Instagram ID. Please follow me there. Any queries, etc. that you have, feel free to ask, and there will be questions, etc. related to this subject that you will find plenty, and you can always, improvise. So thank you very much for holding on, everybody, and I'm looking forward for your suggestions and whatever that might have come in the exam hall. So all the best for your results. Thank you and bye-bye.